Hi, everyone. This is Rakesh Khurana, the Danoff Dean of Harvard College, and with me is my wonderful colleague, Mary Waters, the John Loeb Professor of Sociology. Mary, thank you for joining me today for a few minutes.
I'm happy to. Thank you, Rakesh.
It's so hard to give Mary a brief introduction. She's such an accomplished scholar, demographer, her extensive work on social identities, immigration, and in fact, also how natural disasters affect social outcomes and individuals. Just really glad to have you as a colleague at this moment, Mary. So, a couple of things that, have been, I think on the mind of many of us is, what the pandemic means. And there's so many different lenses and perspectives to try to understand it. We often hear increasingly about the public health perspective. There's an economic perspective. People are talking about the political perspective. What would be the sociological way about thinking about pandemics or similar types of social disruptions?
Yeah, I mean, a sociological lens would look at what the pandemic enables us to see that we take for granted or that we just don't see in everyday life. So it lays bare kind of how our society operates for good and its shortcomings as well. So, for instance, the debate about closing schools in the early days of the pandemic, the New York mayor was resisting doing it because how could kids would be hungry, they wouldn't have food. And if you stop for a moment to think about that, we weren't worried that kids were not going to be able to learn. We were worried that they would go hungry. And we just take for granted that we have families who are so poor they can't feed their children and they need to have lunch at school. And this is something that, we know about, but something like the pandemic just brings in front of our eyes. So it's laying bare a lot of inequalities. Can work from home, who can protect themselves from the disaster, from the virus, who's most likely to have underlying health conditions and how those are tied to social conditions. So it lays bare, I think, a lot of the inequalities in our society. It also lays bare some of the strengths of our society. So it shows what sociologists know about disasters, which is exactly the opposite of what you see in a lot of movies or worries that people have, is that in most disasters, people run to help. They don't, society doesn't break down. People don't, retreat and have guns and try and kill each other. They actually go to their neighbors and try to help them. And we have a real altruistic side to us. And so I think we're seeing that as well. And that's very heartening.
That's such a important perspective that you're bringing. I mean, there's two things that you just shared with me. One is very rarely do we get to sort of watch the machinery of society stop, the whole system. And when it stops, you can really kind of begin to examine its parts and its components, and you're sort of sharing what it reveals. And the second thing is that everything that we're taught about individuals, that we sort of retreat into some Hobbesian state of war, of all against all, in fact, is the opposite. That actually there's people on the front lines, they're caring, they're delivering food for folks, they're watching out for neighbors, they're checking in on elderly folks. What explains these two contradictions that is the way people are and the way and the stories that we talk about in terms of the way society is structured around individualism or a kind of radical self-interest?
I think many times disasters and our worries about them brings up our fears rather than our strengths. And so, if you become afraid, you start to imagine, bad things that are going to happen, and you start to think, that human nature is going to be laid bare, be aggressive or selfish. And I think what we know from studying past disasters is that sometimes that happens, but it's pretty rare. And so our fears kind of take over and make us forget our history and our knowledge of our neighbors and our families and our friends, which would tell us, no, we wouldn't behave that way, and no, neither would most people that we know. So I think we project onto society things that we are afraid of rather than kind of acknowledging the reality.
It's such a deep insight, because once you start thinking about it for a moment, from an evolutionary perspective, if the first time we confronted something really challenging and difficult, we sort of all separated our ways, the likelihood that we would be able to even survive as a species is pretty low. So, I mean, now that you said it, it seems so obvious, but the everyday image and the stories and the way even what's portrayed outlier events as the sort of median event is critical. I think some of that, I'd love to sort of just talk a little bit about your work. I think we saw some of that disconnect in Katrina, with what the initial reports were of what was happening versus what was really going on the ground. And I was wondering if you might speak to that a little bit.
Right. The reports coming out of Katrina very much were about snipers and looting and people, being in danger. And in fact, much of that has been refuted with later research, that there weren't snipers. People were imagining that. People, there were not people trying to hurt doctors who were trying to help people. In fact, there was an incredible army of people who showed up with small boats and saved people from their roofs, and people helped other people walk through the water. And in the convention center, people were helping one another. And there were rumors that spread that people were being killed or raped in the convention center, and it wasn't really happening. What was happening was that most people were helping each other. Now, both with Katrina and also with the current day, what you rely on also is good leadership. And what you need is leadership that brings out the best in us and doesn't play to our fears. So when you have a good leader in a situation after a disaster, they recognize that people can be courageous and they can be unselfish, and they reward that. On the other hand, you can play to people's fears, and you can play to divisions, which we have a lot in our society. So for instance, immigration has been something that immigrants have often been blamed for epidemics, and they have been blamed for sickness. We created Ellis Island in order to do health screenings of immigrants as they came in, because of this belief that immigrants were bringing sickness into our society. And that, is unfortunately being mentioned now. And today the president said he was going to stop all immigration into the U.S. when immigrants are vastly overrepresented in the people who are in the health professions, in food service, in growing our foods. So, sometimes when you're in the middle of a disaster, you look for scapegoats. And I think we can see that happening now, as we did during Katrina, when people were blamed for their poverty rather than us taking responsibility for the fact that there were people who were so poor that they had no way of escaping a city that was very much at risk.
So one of the things that you said earlier is that, there's nothing good about COVID-19. The humanitarian costs are huge and incalculable in so many different ways. And yet it also reveals a lot about our society and things that either we didn't see or chose not to see. What do you think would be, not maybe a laundry list, but 2 or 3 things that we could think about that would allow us to emerge as a stronger society post-COVID-19?
Yeah, it's a good question, Rakesh. I think, first of all, we've had we've had in recent years a real problem with people not believing and respecting science and funding science, the government not funding science at the levels I think we should. So I think we're looking to scientists now to help us to find vaccines, to find treatments for this virus. We're looking at epidemiologists to help us understand its spread. So I think respect and a investment in science would be something that could come out of this. Secondly, I think back to the Depression and the ways in which that depression really intervened in growing inequality in the United States that was happening in the decades before the stock market crash. And it led to the New Deal, which led to a long period of really growing prosperity for all levels of Americans, especially those at the bottom. So I think that we recognize, and just in the past few weeks, there's been agreement across the aisle between Republicans and Democrats that we need help for Americans in the middle of this economic crisis as well as a health crisis. And so you see people coming together to kind of think of ways of providing support for people going forward. And then I think, there's always the possibility in a crisis to think of new ways of doing things and to think of new ways of being together and capitalizing on the ingenuity and the resourcefulness that some of us didn't even know we had. Some of us worried that we don't have the strength for this. And I think, just talking to my students, people are realizing it's very tough and it's not what they want and it's not what they signed up for. And they're very sad about all they've lost, but they're also realizing they're very strong and, they're realizing what is important to them in their lives. And that's always something that we can build on and try to create something better out of.
Thank you so much, Mary. I really appreciate everything that you shared. I think, again, one of the things that I really appreciated about this conversation is that we have a choice as a society, as a group, as a community, as individuals, to use these moments as a moment of what we want to bring forward with us on the other side, and how we could be a better nation and better neighbors. And these are choices that we can make. They obviously require a lot of different institutions to work together, but that we have, what you just said is described, agency in a world that can sometimes feel constrained, to start making better decisions collectively as well as individually. And I think it's a great note to have at such a challenging and trying moment. Thank you for taking the time, and wishing you and all your loved ones safety and well-being at this moment. And thank you for everything you do for our students and our community.
Oh, thank you very much, Rakesh. It was a pleasure to talk to you about sociology as well as other things. So I appreciate it.
Thanks. Take care.
Take care.